Thank you so much for that introduction. My name is Dr. Raymona Lawrence, and I'm going to share my screen with you so that we can get started with this research update. So this is COMPASS, guiding the direction of community-engaged sickle cell disease research for the Sickle Cell Community Consortium 2020 Leadership Summit. And again, this is our research updates. So, as I stated before, my name is Dr. Raymona Lawrence. I'm an associate professor of community health in the Jinping Su College of Public Health at Georgia Southern University. And again, I am the director of research and honored to be with you with the Sickle Cell Community Consortium. So our objectives for today, one, I just want to establish the history of research involved with the Sickle Cell Community Consortium, talk a little bit about the current research partnerships that we have and that we're involved in with the SCCC, and then define the future of sickle cell disease research within SCCC. So our premise for research and really how we do things is community engagement. And so when we think about community, you are the community, our CBOs, our patient partners. And so what we want to do is just to have this paradigm shift. We really want to make sure that we are hearing the voices of the people who are directly affected by sickle cell disease, whether it be our CBOs, our patient partners, their families, and make sure that that voice is inserted into research. And so what is the result of that? Why do we do things that way with the consortium? Well, one is that we do this because we want to learn and adjust. There's no way to learn if we're not talking to the people who are directly affected by this disease. Another thing is that we want to have effective decision making. It is so often that we hear about decisions that are made for us and not with us and by us. And so when those things go out to the sickle cell community, they fail. And we don't want that to happen. We want to do things differently. We want to make sure that research is founded and grounded upon what we are asking for in the sickle cell disease community. It also saves time and money, because if we do all this research and it's not going to work on the ground in the field, then it's a waste of time and money. It also builds up trust, because we know about the history of mistrust and things that have happened with African Americans and people of color in general. And so we really want to ensure that when we're participating in research, that research can be trusted, the people that we work with can be trusted, our partners can be trusted, and that we can trust that this research is going to lead to outcomes that affect our community positively. It also, again, that leads right into accountability. We want to make sure that people that we work with are accountable. We even hold ourselves accountable for the things that we're doing for the community, because we know that it's not just about us. It's not just about this current generation of people. It's about all those who will be affected by sickle cell disease that come after us. And so we know that the Sickle Cell Community Consortium's motto and saying is nothing for us without us. And that is how we do research with the consortium. So a little bit about the history. When I came along to the Sickle Cell Community Consortium, we were able to obtain some funding, and that funding we called COMPASS. And so that was the name of the funding that we received at that particular time. But it's also what I've continued to use as an kind of an acronym for what we do to guide sickle cell research for the consortium and for the sickle cell community. So COMPASS stands for Community Participation to Advance the Sickle Cell Story. So a little bit about the background of COMPASS, the research study. It was a $50,000 cooperative agreement, and it was funded by the Patient-Centered Outcomes Research Institute, which is also called PCORI. So it was a Tier A award, so it was not research. It really was there to develop the research partnerships and identify these CER or comparative clinical effectiveness research research questions that were important to patients, researchers, and other members of the healthcare community. And so what we did was we wanted to generate a list of those patient-generated research priorities and those CER questions, and we did that through engagement, education, and we empowered you with those questions. So what were the outcomes of that? What were the Warrior Sickle Cell Disease stakeholder specific comparative effectiveness research questions? Well, one thing you all wanted to know was, what is the comparative effectiveness of alternative therapy? So, you know, we always think about the fact that people with sickle cell disease don't want to take a lot of medicine. They don't want to be on opioids and these high-powered types of medicines, like sometimes the stigma says. And so what we found from the community is that, hey, if you give us some alternatives, we'll take those. We don't want to continue to pump ourselves with this medicine. And so the question was, what's the comparative effectiveness of alternative therapy like breathing, exercise, yoga, mindfulness versus this opioid use on pain outcomes in individuals with sickle cell disease who have chronic pain or who are at least 13 years of age. Another question was, what is the comparative effectiveness of various modalities? So we're thinking about online versus face-to-face, or individual versus group mental health services on pain outcomes in individuals with sickle cell disease who have chronic pain and are at least 13 years of age. And so as we thought about those questions. As you know, we developed those questions at the summit before, and what we have done is continue to keep those things at the forefront of our mind, because we know that that is what you all wanted to see. So that leads into our current research partnerships. So the partnerships have had to be strategic. They align with the patient and caregiver priorities that I was just talking about that have been developed. They also further solidify our infrastructure, as well as our processes that we go about with research in the consortium. So one of the things that we've done, and that's really exciting to develop the infrastructure of our consortium and of research in general, is to develop this medical research advisory board that has been established within the last few months since we have been at the last summit. And we have these advisory board members now. We have Dr. Betty Pace at Augusta University, Yvonne Carroll at St. Jude. We have Dr. Wanda Sherney, who is at SCDAA, the Michigan chapter. Dr. Titilope Fasipe, who is at Baylor College of Medicine. Dr. Layla Clay at Johns Hopkins All Children's, Dr. Elizabeth Kling at Boston University School of Medicine, Dr. Paulette Bryan at Novant Health. We also have Dr. Julie Cantor at University of Alabama, Birmingham, Dr. Amar Zaidi at Children's Hospital of Michigan, and then Dr. Amber Yates of Baylor College of Medicine. So you all know a lot of these individuals. They have been champions for the sickle cell community for a long time. They are not new to us. And so we're very, very excited about having them aboard and having them to kind of vet some of the things that we're doing for research. And so what do? They review the research studies and materials. They ensure that what we are doing is beneficial to the sickle cell community, and that it is something that individuals with sickle cell disease can use to have positive outcomes with their health, not just individual patient health, but comprehensive life, right? So some of the things that they've done already, you all may have received a CBO letter of support, because we heard that there were times when you needed to just go and get bulk items for the community, and that there were establishments that were not giving those to you because they didn't know, exactly who you were. There was a shortage of things for everybody. And so we developed that letter. They signed off on it quickly, and that was sent out to you. So that's one thing that they've already done. There were also COVID-19 flyers that they have reviewed to ensure that there was proper information on there for you all. And so they have really started to hit the ground running. There's so much more to do, but they have been established, and they are there to back you and to ensure that any type of research that we do with this consortium is medically sound and that you're getting the things that you need. So remember, I just was talking about the CER generated questions. So the comparative effectiveness of various modalities, remember that one, of mental health services on pain outcomes in individuals with sickle cell disease. Now, so one thing that we've done is now to establish our position in studies that are doing these types of things. And so we are on a study called Charisma. It's the cognitive behavioral therapy and real-time pain management interventions for sickle cell disease via mobile applications. And so what they're doing with this study is addressing the need for effective non-pharmacological pain interventions in sickle cell disease. It's what you asked for. And so our aim is to just overcome those barriers to the routine use of behavioral treatments for pain in adult sickle cell care. So the PI is Charles Jonas Saint. He is at University of Pittsburgh, the Department of Medicine. And so we have been working with them. This study is in the very early stages. And so we're working to recruit some of you to be a part of that and to ensure that we are looking for those alternatives to that, the pain management and opioid use in our community. So what is the future of sickle cell research and involvement with the consortium? Well, of course, we are going to continue to identify research priorities of patients. So that is the main focus. What do you need and what do you want? So there is a study that we're developing, and it's called Stand Up for sickle cell disease CBOs. And so what does stand up mean? It's upping our standards, right? Upping our standards for CBOs. And so we realized that the sickle cell disease community-based organizations, they have really spearheaded national efforts in disease awareness and advocacy, and their ability to establish sustainable healthcare system partnerships to improve care or to address research questions remains constrained. So why is that? Because CBOs have historically lacked the infrastructure and skills to perform the work that we need to really carry out research studies, to perform different advocacy tasks. And so this forced dependency on the medical centers and these other researchers, it really creates this power differential, right? There's this thing that's always happening, that the medical centers are here and the CBOs are down here, right? And we don't want that to happen. We want to be able to lead research. We want to be able to be the driving force behind the research that's happening in our communities. And so what we need is a standard. So what we propose is a convening of sickle cell disease stakeholders that's designed to engage stakeholders in the development of a list of cross-cutting standards for community-based organizations dedicated to individuals with sickle cell disease. So let me put that in plain language. What am I saying? What we want is a list of things that anybody in the world knows, whether it be a patient, whether it be a healthcare system, whether it be a researcher, they know that wherever they are, whatever geographic location they're in, they can go to the CBO in that area and they can get this very basic list of things. And so that way we know what CBOs can do, we know what we can count on you for. And we know that CBOs have a certain amount of capacity, right? And so that's very helpful when you're trying to partner with researchers and partner with healthcare systems, pharma, and other individuals like that. And so there would be very, very simple standards for all CBOs. So what do all CBOs do? A short list of maybe 10 things, okay? And then there will be some advanced standards. So some CBOs want to participate in high-level research. They may want to do advocacy or other types of things like that. So they could have an additional list of standards on top of the individual basic simple list of standards that all CBOs have. So what we're doing is developing that list now. And so we will be contacting some of you to ensure that we have a comprehensive look at what CBOs do and how we can share that with the entire world through this comprehensive list of standards. So more about future directions. The consortium will act as a liaison between researchers and patients and caregivers. So if we have this list of standards that I was just discussing, then we'll know who do we contact as research CBOs. Who do we contact as a CBO that might want to do more advocacy? Who do we contact as a CBO that wants to just provide more services? And so we will be able to be a liaison for you for those different types of things. Patients and caregivers will be linked to studies that align with patient and caregiver priorities. And so again, being that bridge between you and the work that's being done. Also, we want to promote participation in clinical trials. We know that it's extremely important for people with sickle cell disease to participate in clinical trials. We will continue to give education through Warrior University because we want to give the right information to you and help you to get that information from our trusted partners like our Medical Research Advisory Board and from others that we trust with information for the sickle cell disease community. We also want to encourage researchers to include patient voice through the addition of qualitative research methods. So there is a lot to be said about numbers and things like that, but when you include the patient voice and what patients believe and what they think about those numbers, then you really have some power behind those statistics. And so that's what we want. We want your voice to be in every research study that we are a part of with this consortium. Also, we want to continue to solidify our research infrastructure. We will develop more advisory council with some of you from the CBO. We also want a patient and caregiver working group and advisory council. And so we have really established that medical board. We have them moving forward. And now we will continue to pull in other partners as well. So we'll continue to talk with pharma and corporate and make sure that they attend meetings specific to sickle cell disease and rare disease and other health disparities. Understand sickle cell disease stakeholder research priorities. So what is it that we care about and how are you a part of that for the individuals in pharma and corporate? Also, we want to urge them to get to know people with sickle cell disease. Include individuals with sickle cell disease on advisory boards. We want to move pharma and corporate into true engagement. And so not just having things done to us, but how are we a part of leadership in the things that you all are doing in your studies, okay? And then advocacy. How do you advocate for people with sickle cell disease and ensure that we have a voice and that you are being a bridge to the voice that we need to connect to those necessary resources and things that we need in this community. So that is an update about things that are happening with research. We open your suggestions and other things that you have, and I'm very appreciative and thankful for you for being the compass, because what we do in research is based on the things that we hear from you. So you are the compass for sickle cell disease research, and I am very grateful for that. So thank you for listening to this update, and I open it up to any questions or comments that you may have at this time. Thank you.